My name is David Nisley. I am one of the lead therapists here at DreamLife Recovery. I specialize in the LGBTQI plus population, and as well I see other clients. Here at DreamLife, our LGBTQI plus program has been running for approximately 2 years. That program has a track that focuses specifically on individuals who identify as part of the community. Our track works to be inclusive and welcoming, not only to everybody who comes into DreamLife, but specifically our track is for the LGBTQI plus population. In our track, we have individual sessions that focus on the coming out process, that focus on stressors related to coming out and self-acceptance. We also address internal and external homophobia. We work on, the importance of sober support systems and allies, not only, for drug and alcohol issues or mental health issues, but also how do we connect those individuals with members of the LGBTQI plus community so that we can form that support system around us as we're in the coming out process or we're dealing with our substance abuse or our mental health. And so here at DreamLife, not only do we have individual sessions that allow a client to focus on their individual needs, but we also have a specialty group that allows individuals to have that sense of community here in treatment. So there's a correlation between substance abuse and mental health issues in regards to individuals who are in the coming out process. Typically in the coming out process, there's a lot of anxiety and a lot of depression that come along with coming out. We are identifying who we are. We are accepting our sexuality. We're looking for healthy role models to help us in that process. Also, in all of that, we are communicating with our loved ones, our family members and friends, who we think we are. So if we already have issues with depression and anxiety, the coming out process sometimes can be compounded by those issues. A lot of times, some of the coping skills that individuals utilize in regards to dealing with their sexuality, in regards to maybe trauma that has complicated their sexuality, are substances. Statistically, 39% of the LGBTQI population, or 17% of that population, have used illicit drugs in order to help cope with mental health issues related to the coming out process, or just helping them cope with the stress, anxiety, and depression that comes from the lack of acceptance, whether it's internal acceptance that we haven't accepted, or if it's external acceptance that we're looking for from others. As members of the LGBTQI community are referred and attend services with DreamLife, what they can expect here is a staff that's diverse. They can expect a staff that is also members of the community, as well as we are an inclusive environment for every client that walks in the door. Our goal is to make everyone feel welcome and have their needs addressed while they're with DreamLife. Specifically, they have a therapist that, can share experiences with them that make them feel comfortable, that allow them to continue to make progress either in the coming out process or to discuss any other issues or concerns that maybe aren't related to being a member of the LGBTQI plus community. However, our group does allow for them to have that support while in treatment from other members who are also here seeking treatment, which at times, and statistically, having other members in specified track allows individuals to, one, feel comfortable, but also to address contributing factors to their mental health or their substance abuse more effectively. So for any member of the LGBTQI plus community that would be seeking treatment, that potentially are unsure if DreamLife is the right facility for them, what I would say is we have had a success track record of serving this community in a successful manner. We have been a welcoming and inclusive environment. We see individuals on an individual basis, which means that we look at the person as a totality of what their needs are specific to that person instead of looking at them as just another client. We want to give them the best possible care and individualize it as much as possible.